All right. So now we're going to go down into the lower respiratory tract. So the conditions that we're going to cover in the lower respiratory tract, we're going to look at aspiration pneumonia, because you do see this a fair amount of time. Metastatic or embolic pneumonia or pulmonary thromboembolism, I'll mention that briefly. And acute, the interstitial pneumonias, we'll compare and contrast these four. And then we will just briefly mention pleuritis and pneumothorax and diaphragmatic hernia. Mesothelioma, you hardly ever see that, so we'll just talk about these three. And we'll probably end up with anaphylaxis. Okay. And we did have a suspected diaphragmatic hernia in a cow, which is pretty unusual. So I'll probably talk about that as well. So before I get to that, so now we're talking about the lower respiratory tract, so we're talking about the lungs. And in general, when you're looking at respiratory disease and the lungs, we're talking about pneumonia. And I just wanted to bring to your attention, this was an article on respiratory disease in sheep, talking about treatment and control. And I just wanted to emphasize that we talk a lot about drugs as far as treatment of pneumonia, but there are some other factors as well that we should be aware of. And this is the time that you write, or take a picture, or just sit back and be bored and then miss it. So your choice. So management factors and natural factors that are associated with respiratory disease. And even though this is talking about sheep, it's basically talking about, it basically pertains to all human species as well. And it's pretty intuitive, I guess, or self-explanatory. If you think about it, you realize that yes, these are management factors that are involved in ruminants, in raising ruminants. And you can walk through the barn and you can see some of these factors at work. Any barn, not just our barn, but any barn, you can think about these factors as you walk through them. So management factors associated with respiratory disease, so things like overcrowding and poor ventilation. So that's fairly self-evident. And anything that's causing animals to be crowded closer together, or a lack of proper ventilation is gonna influence whether you have a spread of respiratory disease through the herd. Soil bedding leading to high environmental ammonia levels and increased humidity. So what that does, you guys remember which class of that? The physiology maybe, when they talked about the respiratory epithelium. You guys remember that? Sure. It's as if it was yesterday. And so you remember you had that ciliated epithelium, right? That lines the respiratory tract. So and you have that mucociliary clearance escalator. They have a nice fancy term for it. But anyway, what high ammonia levels do is it decreases the rate and the strength of the ciliary clearance of the cilia actually moving. It affects the ability to move properly, which in turn affects the ability to clear mucus from the respiratory tract. So something as simple as soil bedding could actually have an adverse effect on the animal's respiratory tract. That's one of the reasons why we emphasize, putting the animals in clean stalls or keeping them in clean stalls and changing the bedding frequently. Okay. Some other management factors, things like decent handling and transportation. inadequate nutrition. These are basically involved in decreasing the animal's immune response to diseases. So basically stress. So you're familiar with transportation stress, shipping, fever. Basically, you're decreasing the animal's immune response to disease. And then, of course, there's some factors, that's outside the control of management. So things like, weather conditions, certainly the breed or genetics of the animal. Gender, males are possibly more susceptible than females in a lot of instances, in a lot of diseases. And of course, the age of the animal. Younger animals are always going to be more susceptible than older animals to disease, and certainly to respiratory disease as well. All right. So you have two sets of conditions, management factors and natural factors that are associated with respiratory disease. So hopefully you've taken note of those, and hopefully you'll be able to discuss them, or in a multiple choice setting, you may see some of these terms, and you know that they're management factors versus natural factors. All right. So every time we're dealing with newborn animals that have been bottle fed, for example, we inevitably have a few cases of aspiration pneumonia. So aspiration pneumonia, caused by inhalation of large amounts of foreign material. Most common cause, passage of a stomach tube down the trachea during administration of milk or liquid medication. What tends to happen when people have to bottle raise a neonate, a calf, or a kid, or a lamb, is that they want to do it quickly, right? And sometimes the neonates are weak, they have a weak supple reflex, and so a lot of times you're going to use the esophageal feeder. You guys have seen that in the barn, or some of you have used it. So basically, you're just talking about a solid tube that you introduce through the mouth, and you hope that it goes down the esophagus, and then you basically just tilt the feed up, tilt the milk up, and it goes down the tube. But inevitably, especially if you're inexperienced, sometimes it might go down the trachea, and then you set up an aspiration pneumonia. Aspiration pneumonia is very serious. The first thing that owners will notice is that the animal is, very depressed. It doesn't really feel like eating anymore, but it feels very sick. As the pneumonia progresses, they're having difficulty breathing. So polypnea, this means breathing very rapidly, or tachypnea would be another term, and certainly dyspnea, so they're having difficulty breathing. Coughing, if they're strong enough, they're going to try to cough up what they've aspirated, so coughing may also be a sign. And foul breath odor in aspiration pneumonia is one of the hallmarks that you'll see, along with fever. So you're presented with an animal that's very depressed and febrile. In the course of your physical exam, you notice that it's coughing, it's showing you signs of dyspnea. It has these auscultable crackles and wheezes, very loud crackles and wheezes. And the foul breath odor. You put all that together, along with the history that the animal is being bottle fed, and you come up with your diagnosis of aspiration pneumonia. Most of the time, the vast majority of the time, we don't bother to go into to do radiographs, because we pretty much know what has occurred at that point. And also, you're trying to do things as quickly as possible. You don't want to spend extra time taking radiographs and laying the animal in recumbency, because it might die while you're trying to take the radiographs. The thing you need to make the owner aware of is that they're going to have to commit to long-term antibiotic use. So the cases that we have successfully treated for aspiration pneumonia, we've had to have them under antibiotic therapy for like 2, 3, 4 weeks. All right, so long-term antibiotic use. Anti-inflammatories as well, so flunacemeglumine or dexamethasone if you get the animal in acutely. You could try dexamethasone followed by your non-steroidals like flunacemeglumine, along with antibiotics. What type of antibiotics? Basically broad spectrum. The thing about aspiration pneumonia is that they also tend to develop anaerobic bacteria infections. So you're talking about using things like metronidazole, which is a little more expensive, but again, the owner is going to have to be committed to antibiotic use long term if they're going to hope to get this animal cured. And you're also going to have to stress to the owners that the prognosis is guarded. Aspiration pneumonia is very serious in all species, and you always have a very guarded prognosis. The cases that we treat, I think the majority of them do not make it, so it is a very guarded prognosis. The metastatic or embolic pneumonia, or the metabolic or embolic pneumonia or pulmonary thromboembolism. There are a number of synonyms: caudal vena cava thrombosis, embolic pulmonary aneurysm. They all refer to the same disease. Basically, what happens with these animals is that they have a septicemia or septic focus of infection somewhere on their body. You mentioned a number of places where the infection has originated. Most commonly is going to be a liver abscess, secondary to ruminitis, but it could also be something as seemingly unassociated as a foot rot. So basically, it's a bacterial infection that occurs somewhere in the animal's body, and there is a sequelae that we outlined there, sequence of events that leads to a septic thromboembolism leading to abscessation of the lungs. This is a very, very serious condition. It's one of those conditions that's also tends to occur in feedlot cattle. So again, you have another thing to add to your list of conditions that occur in feedlot cattle. And remember, we have underlined here, most commonly involved is a liver abscess, secondary to ruminitis. So in the feedlot situation, what's happening is that they're trying to put weight on as rapidly as possible. So they're feeding the animals, a high grain diet, so highly fermentable feed. What that can result in, though, is a rumen acidosis and inflammation of the rumen or ruminitis. And then, as a sequelae to ruminitis, you can get bacteria migrating to the liver and setting up abscesses. And then, as the liver drains through the vena cava, you also are draining these bacteria, and you set up this multifocal abscessation of the lungs. So that's basically what tends to occur. So the clinical signs that you see is usually a pretty rapid onset of these clinical signs that are listed here, and they're pretty dramatic clinical signs. The animal appeared to be doing well yesterday, and then today you see this dyspnea and groaning. So it's really painful. So it's groaning as it breathes, and it's coughing. And when you auscultate it, you hear this wheezing over the entire lung field. Okay? So the fact that you're seeing this set of conditions in a cow on a feedlot is usually pathognomonic, especially when they start coughing up blood. So the respiratory signs, especially widespread wheezing, plus hemoptysis, and by this time there's a lot of internal hemorrhage, so they're starting to get anemic. So you see that combination of signs in a feedlot animal that tends to be pretty pathognomonic. All right? And as I told you earlier, there's really no effective treatment talk about doing, antibiotics for extended periods of time, NSAIDs, but you really want to concentrate on control. By the time you see the clinical signs of an animal on a feedlot that was doing well yesterday, today it's growing as it breathes, it's struggling to breathe. When you do your physical exam, you're getting widespread wheezing, the animal looks anemic, it starts coughing up blood. By the time you see all those signs, unfortunately, it's getting ready to die, so the prognosis is pretty grave. So what you want to do is talk to the feedlot owner about control. So if you have to list some of the control methods to prevent ruminitis, that's what you're trying to do. You're trying to prevent ruminitis in order to prevent the sequelae that could result in a thromboembolism. So some of those control methods are listed here. Slow adaptation to feed, and by including antibiotics in the feed. So yes, antibiotics are routinely added to the feed, and one of the reasons for that is to try to prevent the bacteria that could result in causing pulmonary thromboembolism. So routinely they'll add things like tetracycline to feed that they give to cows, and that's one of the rationales for doing that. Slow adaptation to the high-grain diet on the feedlot. In an ideal world, that would be great. In a practical world, it's not always possible because, again, they're trying to maximize the amount of money they're getting from these animals. So they're going to try to feed them as quickly as possible to have them gain weight as rapidly as possible. So the interstitial pneumonias are listed in your, or are discussed in a little more detail in your notes. And what this table is doing is basically just comparing and contrasting the four main types of interstitial pneumonias that we discussed in the notes. So you have your acute respiratory distress syndrome, ARDS, and you have extrinsic allergic alveolitis, EAA. You have chronic sequelae of ARDS and EAA, and then you have parasitic pneumonitis. So it's kind of an artificial division of acute respiratory distress syndrome. Basically, all of these are going to present as acute respiratory distress. And the main one for you to focus on is your ARDS, acute respiratory distress syndrome. But all of these are classified as interstitial pneumonias. Remember we had said when we started lecturing on the respiratory system that when you take radiographs of a normal ruminant, it looks like an interstitial pneumonia, but these are actual diseases that cause interstitial pneumonia in ruminants. Okay? So the hallmark of acute respiratory distress syndrome, ARDS, or the thing that you'll notice in the history is that the animals have, or the cows have been suddenly moved from a sparse, dry pasture to a lush green pasture. And so that's typically going to occur in springtime. So the time of year is also going to be a clue that you might be dealing with ARDS. So they suddenly switch from sparse dry forage to a lush green pasture. And in the notes we talk about L-tryptophan in the lush green pasture or in the lush grass. So they eat the rapidly growing grass that contains a high level of L-tryptophan. And the rumen bacteria convert the L-tryptophan to 3-MI or 3-methylindole. And the 3-methylindole is a pneumotoxic compound. And in the notes we mentioned some of the things that this pneumotoxic compound does to the respiratory tract. So you should make note that it causes pulmonary edema, causes hyperplasia of the alveolar epithelium, and it causes hyaline membrane formation, and it causes emphysema secondary to the severe dyspnea. And basically what the 3MI does is it causes the pneumocytes to proliferate. So you have a lot of pneumocytes developing very quickly, and what happens when they develop very quickly is that they also die very quickly. So as they die and they exfoliate, then you get that hyaline membrane formation. So the hyaline membrane formation is as a result of a large number of pneumocytes proliferating and then dying quickly. So you get hyaline membrane formation, and then as a result of that hyaline membrane, basically you're getting a membrane that does not allow for perfusion of oxygen very well. So the animal becomes emphysematous as well. And becomes severely dyspneic, and the severe dyspnea leads to emphysema. So that's basically what's occurring with acute respiratory distress syndrome. So as you can imagine, the clinical sign is sudden severe dyspnea. And one of the not so intuitive things about acute respiratory distress syndrome is that the severely ill animals actually have pretty soft breath sounds. So when you're auscultating them, you may not immediately pick up that they have respiratory distress, but the history that they've been switched from dry pasture to lush green pasture, and they're showing this acute onset of dyspnea, is going to help you to make your diagnosis. All right. And as far as the treatment, so in the notes we say that one thing you might end up doing is just leaving them